So the stem cells that you're delivering, they don't stay there. They're just providing the microRNA?
Yeah. Right now there's 450 clinical trials going on. There's actually, I think, about 200 are actually open and enrolling using adult stem cells, mesenchymal stem cells, for the sole purpose of delivering a drug-like substance that's natural. And for a few years, we didn't know what they were. It's becoming more and more clear that they're soluble chemicals and they're vesicles. And inside the vesicles are proteins and microRNA, and that's how they work. So it turns out that these cells aren't actually sticking around at all. They're injected into patients, they die after a few days, and they release all the chemicals, and hopefully a miracle happens. But you can see if you really wanted to, if you really wanted to exploit this, you can push these cells even farther than make more of these. So anyways, these are the clinical trials that we're doing, and I think I've given you the background, the rationale of why we're using mesenchymal stem cells. They make microRNAs. MicroRNAs are known in lower vertebrates and to be very regenerative, pro-regenerative, certain microRNAs, and they're also involved in the disease process. They need to be blocked, they need to be interfered with. So we're taking umbilical cord cells, matrix cells, we're growing up stem cells, and we're transplanting those. Most of these are intravenous injections into patients with various diseases that are very similar to humans. Mitral valve disease in patients that have already progressed near to heart failure. Heart disease, this is a heart disease, arrhythmogenic right ventricular cardiomyopathy. It's a disease that's also seen in humans. It's one of the two major diseases that causes sudden death in young people. It's identified in boxer dogs that have a lot of arrhythmias. So that's how we've identified that disease. Allergic dermatitis, inflammatory bowel diseases like Crohn's disease and fistulating Crohn's, we have in dogs. They're enrolling in clinical trials. And an autoimmune kidney disease that sometimes happens after Lyme disease. Patients will get an autoimmune disease of the kidney, and this is very similar to that. And we're right now going for approval for treating directly into the area around the spinal cord in dogs that get discompression of their spinal cord. Next. So I don't think we have enough time to go through the whole process of how this is done, but you're a veterinarian in the field, and our own veterinarians identify cases. We design clinical trials for which there's a good scientific rationale. We assure that the cells or products we're using are safe before they go into the patients. We secure funding, including that which supplements the owner's drug costs and provides them incentives. Very important, the owner consents through a very transparent procedure. We recruit and screen patients, and we administer the therapy, monitor over a long period of time, and follow FDA guidance. There's now FDA guidance for the use of cell-based products in pets. It just came out this year. Next. And we need an app that everybody who's out there working with animals can click on and find a clinical trial. There's nothing like that out there. And there's clinical trials and consortiums all over the country, and you can't find these at all. I mean, you have to Google, and it's just ridiculous. So if anybody has that skill, let me know. Next. And I think I just opened up some discussion right now because we're done about how a pet goes through a drive-through and gets an injection of stem cells. Anyways, I'm happy to answer questions, and thank you for your attention. I'll stay up here. I've asked Sarah to come up with me too. I'll answer any specific questions about things I don't know about. Is that on?
Yeah, I'll just stand over there for now.
Do you have a question? Okay, I have a question. So my understanding is microRNAs, their sequence has to be very specific, right, for it to bind.
Right.
Is there any differences between different breeds of dogs? So if you want to, do you see any small changes in those microRNAs between one breed over another?
Yeah. So the question was about breed-specific sequences of microRNA, and that really isn't known. Okay. But I think that most of the breed attributes, a lot of them are determined epigenetically. So a combination of genetics and epigenetics. So you can be certain that there'll be differences, but if you actually look at microRNA sequences from Drosophila flies all the way up to humans, there's more highly conserved regions than poorly conserved regions. So I would say it's more likely that breeds have a very small effect on microRNAs, and that you could use almost any microRNA kit in any dog breed. Maybe more important how the breeds manifest in disease, and therefore the microRNAs will differ in a disease state because they're predisposed towards that disease. Like Cavalier King Charles Spaniels tend to get mitral valve disease. Now, that's probably a combination of genes and evolution and the way that microRNAs express, not so much the sequences of microRNAs, but the volume and the number of microRNA copies that are expressed.